The Times reported this morning that the NHS will need an extra 4,000 to 6,000 beds to avoid what they are calling corridor care this winter. It is unsafe if 85% of available hospital beds are occupied, yet last winter that percentage averaged out at 93.5%, and they're expecting the same again this year. The trouble is, whilst there are patients pouring in through the front door, nobody is sorting out the bottleneck that gets them out the back door, the side door, the front door again, any door. One of the main causes seems to be the difficulty experienced by the discharge teams in finding the right sort of care provision outside the hospital for elderly patients who are well enough to leave, but not well enough necessarily to look after themselves at home. I want to be clear here. I'm not blaming the discharge team. They do their best under exceptionally difficult circumstances. Please don't underestimate how hard it is finding a care home for an elderly patient, somebody's dad, who needs a nursing home that can support his dementia, but must also be visited by mum who can't drive anymore, so the home needs to be on a bus route. It's hard to find, but far from impossible if you have the time and the data to research all of the care homes that are on a bus route. In the last week, I have spoken to a family whose dad was in hospital for 12 weeks longer than necessary because the relatives couldn't physically get to the care homes being offered by the discharge team. 12 weeks! This was terrible for the patient because he had dementia and he became so much more confused. But it was awful for the family who were having to witness their dad deteriorate in his hospital bed. And it wasn't great for the NHS either. It is estimated to cost £400 a day to stay in a hospital bed. So not only did this single patient stop somebody from using that bed for 12 weeks, but it cost the NHS £57,600 for the privilege. And that's just one bed, times by God knows how many patients every day across the country. And we have an astronomical bill and a horrifying state of events. But we can help. An NHS spokesman in the article said, "We'll be working closely with home care and care home services." Really? This is not our experience. Families, and particularly self-funding families, are given very little, if any, information and guidance to find the best care quickly and safely. This is their legal right, according to the Care Act. Come on, NHS, let us help you. There seems to be an inherent mistrust of services like ours. But we are care home experts. We are independent. We access every care provider. We don't have favourites who pay us a referral fee. We don't take referral fees. What we can do is help your patients find the right care quickly and safely. Let's try to keep the corridors clear this winter and get people out of hospital. Okay, rant over. Call us if you need help with a relative who's in hospital or you're a member of a discharge team who would like some support.